to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Your urinary tract is the system that makes urine in your body and carries it out of your body. But there are times when germs may get into the system and cause an infection, which can make for some serious discomfort. Urinary tract infections, or UTIs as they're most commonly known, in women causes these germs, and in women, these germs sometimes make their way into the urethra and travel into their bladders and kidneys, causing more serious problems. Here to tell us all about UTIs is Express Care's Dr. Jitka Lom. Thanks, Doc, for coming in. Struggled a little there in the intro, but how does one get a urinary tract infection?
Well, it's a great question, because normally our urine is made in the kidneys, as you said, and it travels through the tubes into our bladder and then on out. Mm-hmm. And that constant motion of urine and fluid traveling out flushes bacteria out in general. But if you hold your urine, or maybe you're dehydrated, or you have some other condition that makes you prone to bacteria being sticky, for example, diabetes, you're very sweet, you'll grow more germs, then you'll be prone to a UTI. So typically people that get UTIs are people that are dehydrated, holding their urine, sickly with some other health problem, or with women will tend to get UTIs from sexual contact, because the bacteria that are in the lower area there can go from one side to the other because of intercourse.
So is it the same as a bladder infection?
Yeah, so urinary tract is anywhere from the kidney all the way down to the bladder and the urethra. Bladder is where most UTIs occur. So most of the time when somebody's having a urinary tract infection, it's in their bladder. But it can travel up into their kidneys, or also just be localized at the very end of the urethra. We call that urethritis in men or women.
Okay, and why is it more common in women than in men? I mean, but it's possible for men to get it as well.
It is possible, but it's more common in women because our urethra, that's the tube from the bladder on out, is very short. Men, of course, have a penis. It's a longer urethra. It's a longer tube. It's harder for germs to travel from the outside in. For us, it's much easier. It's shorter. And that's the same reason why children will tend to also have urinary tract infections, and why we teach them, especially girls, to wipe from front to back so that they never get the germs from around the anus, around their urethra.
Okay. So now what are some of the symptoms so that people will know, okay, maybe something's going on?
So typically for UTIs, people have some pelvic pressure. They'll feel a burning sensation when they pee. They'll have to go urinate very frequently. If it's worse than that, you'll have a fever, nausea, and vomiting. But typically it's just that urgency, needing to use the restroom over and over again. Sometimes there's a foul smell too to the urine.
Okay. And so how do you treat it? Does it have to be antibiotics?
Well, not always, but oftentimes you can just flush it out. If you drink a lot of water, you can flush those bacteria out of your system, and cranberry juice does help also. But most of the time, if you've tried that for a day or two and it's not working, you need some antibiotics.
Okay, so how do you know then if the infection has spread, like you said, to your kidney or somewhere else?
So if the infection is already in your kidneys, you'll have back pain over here in the flank, and very bad nausea and vomiting, and also a fever. And then we call that pyelonephritis. It's very serious because it can damage your kidneys, especially in a diabetic again. So if you're having back pain along with your UTI, you definitely need antibiotics.
Okay, so it's something that you need to go to the doctor.
Yeah.
Okay. And so that's another question, is if you have just maybe some of the symptoms that you had mentioned earlier, do you need to see a doctor, or you can just flush it out like you said?
If you're healthy and this is just, you're a regular healthy young person who has no other health problems, you can probably flush it out after 3 or 4 days of just hydration. But if it's not going away, then you need to get seen. But if you're somebody who has other health problems, kidney disease, of course, or diabetes, or certainly if you're pregnant, you need to get checked.
So how does a doctor test for a UTI?
So we get a sample of the urine. We can dip it in the office with a little dipstick that will tell us if there's blood in there, or if there's pus, or if there's a product of bacteria called nitrites, and we measure that and see, and then we can tell you, yeah, it looks like you have a UTI. Another thing we can do is send that urine to the lab. They'll culture it for a few days and see what bacteria are growing. Then we can actually know what is the specific germ and know whether we're giving you the correct antibiotic.
Okay, good to know. So what does it mean if somebody gets these things regularly? I was reading as I was researching this topic that some people, they just, for some reason, get it
keep getting
regularly.
them.
What is that? Is that a sign of something else?
Sometimes, of course, if they're already hydrating and they have good hygiene and all of that. Sometimes it's a problem of a little tiny sac on their urethra where they basically harbor germs all the time that doesn't really get flushed out. Other times they have other health problems, certainly like we keep saying diabetes, or kidney disease, or kidney stones that you don't even know you have because they're lodged up inside your kidney. It's not passing, it's not moving anywhere, but it's a what we call a nidus, meaning a source of bacteria. There's germs stuck on that stone and are constantly recirculating and reinfecting you.
And not able to get out, I guess.
Right.
Okay. Should older women be concerned about getting UTIs regularly?
Yeah, I mean, if there's two extremes of age. Young children, especially children under the age of 2, if they're getting a urinary tract infection, they really need to be checked and investigated because they probably have a problem where the valves are not closing properly and the urine is sloshing up to the kidneys and hurting them, and that can be treated. So young children with UTI should be investigated, and then older women tend to get more urinary tract infections because their vagina tends to get drier. They don't have as much mucus to protect from the bacteria. So it's easier for germs to get up into that area and infect. And that again can be treated with some cream that they can put on the area to keep things a little moister and also to stay hydrated. Because older people don't notice that they're thirsty, and they'll tend to get a little drier.
Okay. And so you mentioned children under 2, I mean, I have an 18-month-old at home. How would you know if they're not able to fully
they can't
communicate?
tell you, right? And they're maybe still using diapers. So how would you know? Well, this is how we know. If a child has a fever and they're sick and they don't have a sore throat and a cough, we always look at the urine, and that's how it's discovered usually. And then they can either catheterize the child, like put a little tube inside and get some urine, clean urine out, or put a little baggie and catch the urine, so you can get a clean catch and then culture it and see. And if there's a urinary tract infection, certainly more than once, then it needs to be investigated.
Okay. And how can you prevent from UTIs?
Well, again, we got to stay hydrated. We got to drink our water. And how do we know we have enough hydration if our urine is clear? If it's not dark yellow, then you're drinking enough if it's clear. So you stay hydrated, try not to hold your urine, wipe from front to back, keep things really clean down there, and control your other health problems.
I wanted to ask you, are UTIs and diabetes, is there a link between them?
Well, it's just that if you're diabetic, your overall metabolism is kind of sweet, and your immune system is not as strong as it would be if you're not diabetic. So you will tend to have more infections of every kind, but also your UTI.
Okay, and my last question is, does cranberry juice really work? And if so, what is it about cranberry juice that makes it, I mean...
It does work, it does work. Okay, so there's stuff in cranberries, there's a molecule in there that makes bacteria less sticky. So they can't stick to your bladder wall, and it'll be easier for you to flush them out. They can't hang around as easily. So and you can buy cranberry capsules too. If you don't like the taste of cranberry juice, you can take it as a supplement. And you can do it preventively too. They've done studies where they just had somebody, if you're prone to UTIs, don't wait till you get one, just drink cranberry juice every day. But it has to be pure cranberry juice, not the cocktail that's mixed with raspberry and whatever else.
Okay, any last parting words on this topic for
Well,
viewers?
there's one other natural remedy that you might be interested in if you're somebody who suffers from this all the time, and it's called D-mannose, M-A-N-N-O-S-E. And you can buy this online, and it's not very expensive, and it's a supplement that you take every day. And what it is a sugar that does not get absorbed into your body, but it latches onto bacteria. So you would drink a little bit of that. You would basically use that as a mop to clean up bacteria and urinate them out every day. And that works really well.
D-mannose.
D-mannose.
Okay, any other advice that you have?
For UTI?
That's it?
Try not to hold your urine. Use the restroom.
All right, sounds good. Well, thank you, Doc, for coming in. And we've got a special treat for our viewers. Make sure to send in your questions for next week. For all you pet lovers out there, Doc will have a special guest next week to talk about pets and your health. You can send your questions to healthyliving@kuam.com. Now, last month we told you about the special Valentine's Day contest that Dr. Lom and Express Care were offering. When Healthy Living returns, we'll take you inside the clinic with Doc with the Valentine's winner. Stay with us.